Hi there, I'm Dr. Heidi Marten, physical therapist and Pilates instructor and owner of Blossom Pilates and Physical Therapy. I'm here to talk to you today about internal femoral rotation. So a lot of people, a lot of women especially, a little bit because of the way that we're built, but males too, are internally rotated in the femurs. So when they squat, you'll see that their knees go in. Oh, that does not feel good. And it can cause knee pain, so like runner's knee, patellofemoral pain syndrome, or pain if you have like hip impingement. This is the hip impingement position. So it can cause a lot of hip pain, labral tears, other issues like that. IT band pain. So anyway, if you are one of those people whose knees chronically go in, this is my favorite functional exercise progression, I guess I should call it, to do. So the first thing you want to do is stand in a wide tandem stance. So I just have one foot slightly in front of the other. From the side, one foot slightly in front of the other. And all you're going to do is think of wrapping your glute around. So my right foot is forward, so I'm thinking of my right glute. This is to strengthen my right glute. This is actually, or right deep lateral rotators. My right side is definitely my more internally rotated side, so this is the side I like to work on. Imagine somebody took a piece of saran wrap and attached the first piece right here on the front of your hip, that pokey bone, and actually just took it around all the way to your sacrum, to your tail, and wrapped it tight. So it's that feeling of wrapping the glute around, front to back wrap. And so you're going to squeeze that, wrap it around, push your whole foot down to the floor, including your arch, because one of the main ways people cheat is to just roll out onto the side of their foot. So don't do that. Push that whole foot in, and then just shift your weight onto the standing leg. It's a little bit bent, and then shift back. Shift onto the standing leg, shift back. Keep that glute wrapped, it wraps more as you shift. Shift back, it releases, and then re-wrap, shift, and shift. So once you feel like, yeah, I am feeling actually real good butt work. It's not like the hardest thing you've done all day probably, but it should feel like, hey, I am doing something. I feel it here, I don't feel it here, I don't feel it here, I feel it just right in the butt. So once that is nice and strong, and knees tracking probably like over toe 2 and 3, right? You can move into maybe a bigger lunge. So you can shift forward into this position, glute is wrapped, maybe step back into a bit of a lunge. And then here you can maybe think of like little pulses, still wrapping that glute. My butt's already on fire. You could think of pitching forward, putting 90% of your weight on this leg, and then doing a little bit of this knee repeater type of business. Glute stays wrapped the whole time. This can progress, of course. You can grab a slider you don't need sliders. On wood floor, towel works just fine, or slippery socks. On carpet, like a paper plate, a disposable paper plate is great. So no need to actually, or a plastic plate too. But sliders are like $10 online, so you can grab those too. But I'm still gonna work my right leg. So my left toes are on the slider, and then we're wrapping my glute around, coming into this lunge, kind of a pitched forward lunge position. As you pitch forward, you get more glute, less quad. So this is almost like a deadlift primer, I guess. And then push the heel into the ground, wrapping the butt to stand. Same thing, wrap the butt to stand. From the side, I look like this. And then this, of course, should hopefully, these are pretty functional exercises, should hopefully progress to you doing the same thing as you step up the stairs, right? Every step you take, when the foot's up on the stair, you wrap that glute, push up. Other foot, push up. And it should progress to every step you take, walking. Everything you do, where the deep lateral rotators are gonna work a little bit better. And then, yeah, just another note, one more note, I'm gonna say it again. A lot of people, you see them go into their squat, they're internally rotated, okay? They'll roll out on their feet a little. Do you see how it looks like I actually am not internally rotated? Like I'm doing a great job right now, right? Except my butt's not on. All I'm doing is using outer thigh and foot and ankle. So instead, push those arches down still and just wrap glutes around. And it should feel like it's all in your butt. And that is the correct way to do it. So end result is completely different, even if I look basically exactly the same. So yeah, keep those things in mind. Hopefully this helps with any pain that you've got. If not, come on in. All right, thanks, bye.